Good afternoon, everyone. My first topic will be on advanced EGFR mutated non-small cell lung cancer. I'm not going to the details of epidemiology of lung cancer. We know that non-small cell lung cancer is the most common type of lung cancer that is seen. This is the distribution of the stage-wise diagnosed cases. Joydeep has already discussed about all the lung cancer mutations, but to be precise, we know that when we are seeing any kind of lung cancer patients, we should first check the biomarkers, the genetic targetable mutations, and also the PD-L1 status, because now treatment of lung cancer is no longer confined to conventional chemotherapy. So this is how we can diagnose the different mutations with help of FISH, PCR or IHC. So today we'll be speaking briefly on the EGFR driver mutations which happen on exons 19 and 21. So this is the picture of the EGFR mutation pathway. Current treatment options which we can see for the EGFR mutation is the first or second generation EGFR tyrosine kinase inhibitors. Among which the most important is osimertinib, which is the third generation irreversible EGFR tyrosine kinase inhibitor, which is actually selective for both EGFR mutated as well as the T790M resistant mutations. It is also effective for patients who have got CNS involvement. This is the most landmark trial, the FLORA trial, which actually is a phase 1 study which studied the safety and efficacy of osimertinib compared to the previous lines of other oral tyrosine kinase inhibitors which are used in the past and have shown better survival benefits. This is the study design where mainly patients of good performance status with respective mutations were taken, and osimertinib was compared to the standard of care other TKIs, and we can see here the significant median PFS, progression-free survival of 18.9 months compared to the 10 months of standard of care. And also we can see here better objective response rate with osimertinib and much better duration of response compared to the standard of care. So on final analysis, we can definitely say that there was statistically significant improvement with osimertinib for the EGFR mutated lung cancers, and that is how it has actually changed or brought about a paradigm shift in the treatment of lung cancer with EGFR mutations. Side effects were well tolerable, except that we have to check ECGs every month to see any change in the QTc prolongation, and rest other side effects were well manageable. Summary wise, statistically significant and clinical meaningful improvement with better OS data and comparable safety profile. So it's now the new standard of care for first line treatment in this kind of lung cancers. It is also effective in the CNS metastasis compared to the other previous oral drugs, with better progression-free survival of about 15 months and also better overall survival. I will skip these slides. It is the comparison of the osimertinib with the previous oral drugs, which obviously show much better benefit compared to the previous lines. So, second line also there have been a few data that is in, but it is always, we have to see that osimertinib should be always used on the first line. It is not possible to predict who will develop T790M mutation. So these are the real world data where it has been used. So in conclusion, we can say that osimertinib has translated better progression survival, significant OS benefit. It has shown significant results in the OS and the PFS with better safety profile, lesser side effects, and is hence the new standard of care for first line treatment in this kind of subset of lung cancer. So I'll do the next one.